Lisa.
Hello, thank you for having me, and thank you everyone for being here and sticking it out through a long day and taking the time to listen to our survivor stories and learn a little bit more about the educational impacts um, during and after treatment. I want to talk to you today about another case study. This one is rather than a specific patient or student, this is a culmination of patients and students that I've worked with is my time as an education navigator. So as you're learning about this, know that this is not just one specific patient that I've worked with, but rather a culmination, but very real experiences that have occurred nonetheless. Um, and I do have the chat up on the side, so I'm going to do my best. As a former educator myself, I love to have the participation. So if you are willing and comfortable at the end of this long day on a Friday to put your input into the chat, I would love to have it. And I'm going to start with taking a look at what you as educators would see this child as first. So I'm going to move ahead. Slides will cooperate. There we go. So as an educator, as a school staff member, what you know is this is an 11th grade student. They came to the United States at the age of 10. They were fourth grade at the time. They were non-native English speakers, so they took the appropriate English language learning courses and supports. Now, at the age of 17, they're in 11th grade. They have passed their required SOL testing. If you look closely, they've just kind of skirted by, like they're making the bare minimum, but they have passed. When they're engaging with others, whether it's staff or students, they are respectful. When it comes to the academic end of things, they are often not turning in assignments on time, if at all. They're consistently late to school and or classes. It could be missing up to half a day or more. When they're in school, they are spending a lot of time out of class. Maybe they're leaving for the bathroom and not coming back in a timely manner or coming in late. So looking at what you as the staff would know or as an educator would know about this student, is there anything that you might do to support them just having this information? And if you have anything to share, I'd love to see it in the chat. Give it a moment to see if it pops. Not seeing anything just yet. That's okay. Oh, do they need supports to complete assignments? Yeah, so you might be thinking they're not turning it in, so what kind of support might they benefit from or could they benefit from if they're needing help turning in assignments? That's excellent. Um, so now another end of it would be the medical side of things, because we know that this isn't just a student, this is also someone who's survived cancer. So this is, in this case, this patient is a acute lymphoblastic leukemia survivor. So from the medical end of things, what the medical team knows is this is a patient who is, again, 17 years old, was diagnosed with acute lymphoblastic leukemia, or ALL, at the age of 12. So we're kind of combining that timeline. They would have been in about sixth grade when they were diagnosed. So they did have some time to be in person learning both the language, the culture, and the academics prior to diagnosis. Again, they were a non-native speaker. Now they're fluent in English. However, their parents remain not fluent English speakers or very limited English proficiency. The medical team is aware that they've completed multiple rounds of high-dose chemotherapy treatment. They have remained in remission, and they do a great job of attending their fellow appointments and the survivorship clinic annually. And their most recent clinic visit, they come in and express difficulties as it relates to the academics, which staff have probably already been seeing, which kind of triggers in their mind that this might be a good time to review and consider and explore the potential late effects from treatment. Now, of course, we're looking at this and we have the school team's perspective and what the medical team's perspective is, but we're talking about an individual here who has their own perceptions and also their family's perceptions as well. So as I look at the next slides here in just a moment, I want you to think about the information here, and then also the information, the perspective that the student has and the parents have about the school, their child's academics and their own academics, and how that might shift what you're thinking, what supports might be beneficial, if any, and feel free again, throw them in the chat. I'd love to see what you're thinking as we progress. I do see some people saying them giving some safe spaces just based off of this right now. Maybe some working at their own pace, electronic submissions, maybe reducing some workloads. You guys have some really great ideas already without even getting their student perspective or parent perspective. But let's take a look at those briefly. So from this child, young adult, really at 17, their perceptions, they know that they had to move to a whole new country where they had to learn a new language and a new culture. And they're consistently going between the two at school and at home. They had this experience with cancer and going through chemotherapy treatment, which meant that they missed a lot of opportunities for in-school learning. And a big part of that also is the opportunity to engage with peers. If we're getting into the nitty-gritty of it, and they're currently 11th grade right now, you think about they were in 4th grade when they moved here, 6th grade when they were diagnosed. If they were going through treatment, into 7th grade, around 8th grade, what would have happened at that point when they're trying to transition back is we had the COVID-19 pandemic. So their opportunity to re-engage in the classroom learning and get reconnected with peers that maybe they were disconnected from for a period of time was kind of missed because we all had to go virtual. So that's something else to add, just another layer to what this child has experienced. And then they also, of course, they know that they have a hard time focusing in class and they often forget information. They're not really sure why that's happening, but just that that's something that is difficult for them. On the other side, we have what the parent knows and thinks. They know that their child had cancer and respective treatment, that they don't speak the same school language. So they have to either work harder to find out what's happening in the school than the average English speaker, or they're relying on what their students telling them. And they know that historically, pre-diagnosis, pre-COVID, pre-treatment, everything, that they were a good student, but now they see that their student doesn't really care. They kind of have this perception, well, my child's just really lazy. I tell them, go to school, do your work. I tell them, when you go home, you have to do your homework. But, at the end of the day, we all know parents also have a heavy load to bear as well. And so that they don't always have the time to monitor. And we also expect at 17 years old that a typical 17-year-old hopefully has some independence, or you would have that expectation of more independence, barring these sorts of experiences. But they do recognize that their child is still quite capable, and they're going out constantly, and they're just wanting to engage in local soccer games and just practice playing soccer in the yard. So knowing all this information of what the school knows, what the medical team knows, the child knows, the parent knows, I see some things popping up in the chat of what you might think now would be beneficial to this student to be successful in school. And I know someone said, having a 504 team, that's absolutely a great idea, is gathering the 504 team to talk about this, getting the perspective as a whole, which is really kind of my goal here, is that there's many different moving parts. And often we don't see all of those parts at once. So having that team come together to talk about all of the experiences are really important. Um, yes, an interpreter for the parent. Thank you. Get them caught up, make sure they're understanding, take that time to get those documents translated so that they have a better understanding of what's happening and they don't have to rely on their child to be telling them what's happening at school. Someone suggested getting some neuropsychological testing to target some academic difficulties, looking for appropriate accommodations. And oh, I like this one. There's a lot of schools are saying offer some alternative classes for those that work at their own pace. It could be a good one, but I would caution with that one, depending on the conversation of what benefits the child. I think John mentioned, checking in with the student of what works for them, because if they're learning at their own pace, they might need someone who's kind of there helping guide them, and having them move at their own pace might be something they're not moving at their own pace now, working independently, so the own pace might not work for them. Or convert on the opposite side, it could, if it's the pressure of I have these so many deadlines, working at their own pace may be a source of anxiety relief, so to speak. Add an accommodation where there's a live working document with an up-to-date to-do list. Lean into the technology tools for translation information for parents, help guide students. Sounds like you guys have a lot of really great tools that you have to either you knew previously or from today that would be good to support the student as a whole and this family as a whole. Because I'll tell you, this is when I had this experience, it was a very moving experience, because when I went back in the medical team, it was a survivorship clinic day, and the provider pulled me into the room and said, they just don't know why they're not focusing, and they're not going to school half the time. And I walked in the room and, I said, you were younger when this happened. But has anyone ever talked to you about late effects of treatment? And I imagine that the providers have talked about it. They have even reviewed it within that appointment, as they often do. But just taking the time to sit there and reiterate that there's maybe a direct connection to the treatment that you went through and your lack of ability to focus in class, and retain that information. And quite honestly, if I could have taken a picture of the face of the dropped shoulders, the relief of, this isn't like there's nothing wrong with me. This is just a part of my journey and what's happened to me. And this is normal given the circumstances of the experiences that I've had. And they quite honestly were saying they were skipping out on those classes because they couldn't they couldn't focus, they couldn't retain the information. And then pulling the parents into that conversation, on the same spectrum too, they were, rightfully so, more focused during treatment of, I need to help my child survive this, get through this, my family to survive this, to get through this. That their focus wasn't thinking about the late effects. And I'll tell you that they cried when they heard it, and they said, all this time I thought my child was just lazy and didn't care. And I just had no idea that they were struggling with such things. So to kind of sum up what I'm hearing and seeing a lot in the chat is, and you guys gave a lot more accommodations than I listed even here, is looking at, extra time to process information. You might be modifying that workload. How that looks may be different depending on the student. Some of that self-paced or the technology pieces that you guys were talking about in the chat are definitely great ways to do that. It could also be looking at quality over quantity of work so that they have less of a workload, they don't feel overwhelmed. Again, it's really based on having that conversation with the individual, especially at 17. We do want them to be working towards independence, but we want to support them towards that independence. Giving hard copies of notes, checking for understanding, or even checking in, having an adult in the building to kind of check in and see where things are at. And as some of you mentioned, the 504s would be those accommodations, but you may actually go on and say, let's push ahead with evaluating for possible impacts of the late effects, especially in the area of executive functioning, since the student's talking a lot about having difficulties with the way they process and hold information. So you might look at doing a full cognitive evaluation and educational assessment and bringing it back to the school team to talk about what the findings are and if they qualify for an individualized education plan, what goals and services might they benefit from in addition to many of the accommodations. And then as several people mentioned in the chat, that you're ensuring there's interpreters, hopefully able to get any documentation translated into the native language of the family to provide that inclusive, supportive educational environment that I know so many educators work so hard to do every day as we live in such a diverse community. I'm going to see, I see we have a little bit of time. And I think I see a couple of questions. Someone asked the question about, is it advisable to allow them to go into soccer? In this situation, I would say, yeah, they're long out of treatment. They don't have any late effects that would limit mobility or cause any sort of pain. Again, I'm not a medical provider, but as long as they feel able to do it, it might be a sense of support. And actually, I might even see if maybe that's a way to hook them into school and get them connected if there's like a school soccer team or a school soccer club. That maybe if they're able to get some more buy-in to school with appropriate supports and everything, that it might be a motivational thing to get that pulled in if we know that that's a high interest area. Let's see, what other questions? So someone asked, how many survivors do you see at Survivor Clinic? So I am up at a Nova Shar in Fairfax, and I don't know honestly the exact number of patients that are seen annually, but I want to say it's over 100. I right now, as it's only my second year in this position, so we are still growing and learning about how to best serve our population. The goal is eventually that I will be able to touch and support each one of those survivors, but I've obviously not met that goal just yet, as I'm still growing and learning in this position. A lot of mine has been more focused on a lot of active treatment to support those kiddos that need the homebound services and 504s as they're returning back to school, doing school lessons. But there are quite a lot of survivors out there. We have survivor clinics 2-3 days a month, and they are fully booked days with I want to say like 15 patients a day. Math is not my strong suit, but if someone wants to take the time to tally that up, that would probably give you a good estimate of, at least in the area where I'm at, the amount of survivors that we have. Checking the chat to see if there's any other questions. Susan, if you see any that I missed too, feel free to let me know.
I think you got them all.
Excellent. Well, again, thank you all so much. And I appreciate your time and your efforts.